So I did a video on a day in the life of a CBT therapist, and I think I wanted to talk about more kind of what happens in a session, or maybe through the course of therapy, because often people feel a lot of anxiety in coming to therapy in the first place. So where you start off with is generally a client would reach out to you kind of saying that they are interested in having therapy for loads of different reasons, and from then I would take the time to obviously either respond to email or message or a phone call, and I would book in a 15-minute consultation with that person. And within that time I would discuss with them a little bit further about what is bringing them to therapy at this time, and also tell them a little about myself, about my journeys in like my training, my qualifications, the different bodies that I'm registered with, just to give them a bit of a feel for me. And one of the most important things that I always say to people is make sure you click with your therapist. This is going to be the person that you're going to be telling stuff that you wouldn't really tell many people possibly. So you really want to make sure that you can get on with them. Like, humour, when used appropriately in therapy, is a great way. So although you're going to be talking about difficult things, you want to kind of feel that you have that connection, that you can maybe have a little bit of a laugh. There can be things that you can just connect with that person with and feel that you can trust them, that you feel empathy from them, that you feel the compassion that you require. Just making sure that they're the right fit for you. So after we have that consultation, I have a document that I send over to my clients, which again explains more about how I work, my training, the different types of models of therapy that I use, whether we are mainly doing CBT or we are doing, as I said, other types of therapy that I may bring in. So mindfulness, schema focused CBT, more DBT informed style stuff, mentalization, chair work, and compassion focused therapy, acceptance and commitment therapy. So there's a few types of therapy that I do, and so I kind of want to explain from that point the different areas that I work within, the different modalities, and how that could really support them. So once we've had the consultation, they've reviewed the document, and they think that they would like to progress, then we book in an assessment. So an assessment is normally an hour-long session, and from this I normally tell people to bring a pen and a pad, because they may want to write stuff down that they say or that I say, and it's a really important process to kind of start that reflective process and really starting to unpack what's going on. Within the assessment, you just really have to bring yourself. It's me that's going to be asking you the questions. I'm going to be talking to you, asking you about kind of what's brought you to therapy at this time. I will be talking about your past to an extent, the types of therapy that I work within. If I'm doing CBT, then I will normally talk about the past, but we're kind of making sure that that past is applicable to what's going on for you now. So we're not going to spend loads of time going over your childhood if it's not something that is necessarily linked. However, in the assessment, it's important for me to get an understanding of your background, to see if I can see any connections that you may not. So as I said, I will be asking you the questions, and we'll talk about things that have happened in your past. I said, what brings you to him? Some general questions about like sleep, eating, water intake, alcohol consumption, drug use, smoking, exercise, just really quite holistic. And that's how I like to work. So I like to look at all the different areas and try and kind of work it all together. And then from the assessment, I sometimes would set a homework. A simple CBT homework would be an emotion diary, where for a week you just write down various situations that make you feel various emotions, and what you were thinking, how that felt in your body, what you did when you was in that situation, and anything that you did that helped you cope. And whether that was an unhelpful coping mechanism or a helpful one, I still want to know. So that is a really simple one that I often do at the beginning. And from the assessment, I would be able to give you a good indication of what style of therapy we would be working within. So if we'll be doing just CBT, or if I'd be bringing in different areas, or would be doing more schema focused CBT. and that will kind of give you obviously an indication if that's the right style for you. And you can have an assessment with people and then still for the client to then think that therapist isn't the right person for me, and that is completely fine. As I said, you want to make sure that you find the right person for you. And then from the assessment, as well as you kind of thinking if we would be the right fit, if I think that I wouldn't be the right therapist for you, I would tell you, I would generally pick that up from the consultation, but sometimes from the assessment I may say it may be best for you to go and do this first, and then come back to me, or I may think, you know what, I think that this style of therapy, which I don't offer, would be best for you. I'm not going to say, yes, let's work together if I don't think that we would be the best fit, or I'll be able to offer you what you need. And then you have the normal session. So within whatever sort of therapy I'm doing, we set an agenda at the beginning. So we set what we want to talk about. So that would be you bringing things, me bringing things, potentially going over homework or tasks that you have been doing between the sessions. And then we would work through that. Sometimes we even kind of structure that in time. So we'll spend like 5 minutes on this, 10 minutes on that, something like that. And we just work through the sessions. The sessions are either 50 minutes long or up to 90 minutes if we are doing any sort of exposure, any sort of trauma work. So exposure could be for anxiety or OCD, and the trauma will be post-traumatic stress disorder. So that would be the time when we do the longer style sessions. And we generally just work through each session. After the first session after the assessment would mainly be the formulation one, which is when we do a map of you, put it all together, we kind of figure all things out, we show things, what's kind of maintaining your difficulties at the moment, what's going to help you, what led to these problems happening in the first place, and giving you a really clear picture of what is going on for you and how we are going to solve that through therapy. And the formulation is something that informs the treatment. I do a formulation with the client. Sometimes we both take it off and then we add things to it and then we bring it back in the session after. We always have the formulation, we always go through it, add to it, change it. It's a working formulation, so it is there to be changed and adapted. And as I said, the sessions generally follow similar structure of the homework or the tasks. You bring something, me bring something, and whether we are working through a model from CBT or we're working through another type of therapy, we will just work through until we've worked through what we've had to do. With CBT, there are some models that are quite structured, so they'll say within 8 sessions or within 12 sessions, so you'll get that idea of how long it is going to be, obviously if you're able to put the work in that is required, because most of the change does happen outside of the therapy session. So you work through how many sessions you have with a client, and then you come to the end and you do a closing session. So that is when we do something called a therapy blueprint, which is basically a blueprint of what you've done. So everything that we've spoken about, everything that we've gone through, and we create that together. And when we have like a crisis plan, or kind of like in case of emergency kind of smash thing, that if for some reason that something's happened, because life is unpredictable, so there could be some things that we don't predict that happen, so it's good to have a plan for something like that, and then we close the sessions together, and that's it. That is kind of how the sessions work. I think I've kind of covered the majority with some of the therapies that I do, not necessarily with CBT, but I offer check-in sessions, so after maybe 3 months or 6 months, just to kind of check in if the client wants that, and I leave that up to the client to contact me. I let them know that it's available, and then I allow them to come back if they feel that they need it. And I think with that, it's just kind of helpful to know that I'm still going to be there if you do need me in the future. It's just because we have a closing session doesn't mean that it's like completely closed. And just another thing, I think in terms of the frequency of sessions, some clients I see weekly, some people I see every other week, and some people I see monthly. Generally, you start off seeing clients closer together at the beginning, then as they progress through therapy, the gaps get longer and longer until you have the closing session. So I hope that has kind of explained it more in detail, and that kind of gives you a good understanding to what it's like.